In 1929, responding to the call of the Bishop of Calgary, the Sisters of St. Martha came to southern Alberta, to Lethbridge, to build a hospital. And at that time, it was the health service in Lethbridge. They've really responded to the needs of the community. What the community needed, they did. And they often did it for very, very little. Sometimes it was bartering for food. And since that time, St. Michael's has had an extremely proud history in southern Alberta.
So St. Michael's today is still able to provide the service that's in line with the vision of the Sisters of St. Martha. People feel as though when we go in to meet with a client or with a family, that time seems to slow down and we have an ability to give that attention to people and have them have the feeling and that create that atmosphere that they are the only people that we're working with at that point.
I often sit in this very place and people come in. They've come here to appraise it about whether they should put their mother or their father here, and I can see that uncertainty. And I say, listen to me. I've been here 2 years now. We are most content with the help and services that she's been given, the respect for the individual. I've never heard anyone, if they've heard somebody who is maybe suffering from a difficult condition, and they've been called on several times to attend to them, I've never heard anybody say, there she goes again. They go and attend to her right away without any hesitation or complaint. And that's marvelous.
I've only been here for about 3 years now, and the very first day that I stepped into this building was a very warm, inviting, calm atmosphere. I wanted to be here. It seemed like the right place for me to be to end my nursing career.
The Bridges program was developed as an outpatient program to help maintain people in their homes, and some of our clients have been coming since the program started. So, you know, they've been coming for a long time, and that just shows that we've been successful in keeping them independent in their home.
When you first walk into the doors of St. Therese, I don't think that you really recognize a care facility. It is a very warm facility. It has large open areas, places for people to sit and visit and entertain. There's a lot of smiles here. There's a lot of joy here.
I had the opportunity to meet with a couple who shared with me that they'd been married for 54 years. They shared with me that her health had deteriorated over the last few years. She was now confined to a wheelchair. I took them to show them the one-bedroom suites that we have for couples. From her electric wheelchair, with oxygen in her nose and tears in her eyes, she looked up at her husband and said, "Look, honey, we have a bedroom." The emotion that was in her voice and the look in her eyes is something that I'll always remember.
People who come into Martha's house live independently in their own suite, just as they would in their own apartment, in any apartment building. But we provide supports. We are keeping people living with grace and with independence well into their 80s and 90s, and having the supports that they need to live a very good quality of life.
The foundation is a way that people are able to show the gratitude for the services offered here, and it's through that support that it contributes back to the community as well as the lives that are touched here every day. Some of the things that has been purchased through the foundation is a bus, and this has been a great asset for the recreation therapists. Another thing that has recently been purchased is a light gate, and so through the foundation this equipment was able to be purchased to add more service and benefit.
Someone said he'll be lucky to be able to walk again. I recall the first time I ever went into the dining room without my wheelchair. And everybody applauded. There were all kinds of nice remarks. And I was able to find my way to my chair and sit down and enjoy a breakfast. That felt so good.
We're the main hub, if you want, for rehabilitation services for inpatient rehab. Things such as a stroke, a brain injury, many individuals who fracture a hip or are involved in multi-trauma, and they come to St. Michael's for that. The hope is that this will become the center of rehabilitation for southern Alberta. So there's big plans to make this bigger than it is now.
St. Michael's has been here since 1929. It's been part of our community. It's been part of our bloodline. We started out at St. Michael's Hospital back then. Without the people in the community, without everyone's support, we can't keep this mission growing.
The palliative hospice here gives another choice for patients and their families in the end-of-life care. Sometimes it's used as an alternative to home, especially for those last days to weeks of life. It's an excellent alternative to home because it offers large, comfortable rooms, and there's good, dedicated, experienced staff who are used to the problems that come up in those last days to weeks of life. If people are going to really do the best they can and function as well as they can, then they're going to need to be supported. And I see St. Mike's as trying very hard to do that well for the seniors it serves.
I'm here as the spiritual and religious care coordinator, and I try to be very supportive to the family who are trying to be with persons in palliative care. We can pray together, and if they need anything special that they can identify in their spiritual faith, then I try to make that happen.
I am privileged and honored to be part of an organization that has been providing health care to the residents of Lethbridge and southern Alberta for over 80 years. We are excited to be collaborating with a number of world-class researchers at the University of Lethbridge. We are hoping to take the knowledge that they generate and translate it into improving our healthcare system.
You know, it's a fantastic opportunity to work at St. Michael's. One of the first things when there's a problem with your brain that goes wrong is that frequently people become disoriented. They get lost, they can't find their way around. If we can understand what goes wrong, then we can start to put in place strategies that will help people improve this performance. And as we're increasingly learning, the brain has more and more potential to repair itself than we ever guessed. And so the ability to actually take the work from my lab, where you see me today, to an actual rehab hospital where we can actually start to implement these strategies and see improvements in people's lives is tremendously rewarding as a researcher.
We are excited to be continuing the legacy of care that was set forth by the Sisters of St. Martha over 80 years ago.